So just to give you some basic data about this aortic valve. So the aortic valve basically is the gate between the main chamber of the heart, which is the left ventricle, and the aorta, which is the main highway. When the heart fills up with blood, this gate, which is the aortic valve, needs to open completely so the blood is ejected into the main highway, into the aorta, and from there it reaches every cell in the body. In some cases, this gate, which is the aortic valve, does not open completely, and the medical term for that is aortic stenosis. When this valve opens partially, still the heart muscle is able to push, to do the extra work and push the blood outside. So for several years the patient does not have any symptoms. However, at some point this narrowing of the valves become critical, and that's the time when the symptoms occur. The symptoms of critical aortic stenosis are chest pain, shortness of breath, and syncope or loss of consciousness. The problem is that when those symptoms occur, the life expectancy is limited. Approximately 50% of those patients die within the next 2 years. So something has to be done at that point. Unfortunately, medical treatment, medical management, so I understand the medication does not work for severe aortic stenosis. So the gold standard of treatment for aortic stenosis is surgical aortic valve replacement. That entails opening the chest, stopping the heart, removing the diseased aortic valve, and replace it to an artificial valve. This artificial valve could be a tissue valve, which is either a bovine or porcine pericardial tissue, or with a mechanical valve. The tissue valve is a good substitute, however, it does not last forever, so it needs to be replaced again after 10 or 12 years. The problem with the mechanical valve is that they might last forever, but they require blood thinners for life. We tend to use mechanical valves mainly in younger patients. However, overall the results with the outcome with the aortic valve replacement are very good. In selected institutions, including Mon General Hospital, the success rate of this operation is 99%. However, there is a significant percentage of those patients with severe aortic stenosis who are older, they're in their 80s, or they have any other medical problems, kidney problems, lung problems, or they're too frail to be eligible for open heart surgery. Again, that represents probably 30% of those patients. Again, there is no effective medical management. That's when the transcatheter valve comes in the picture. This is a procedure which was initially pioneered in approximately 10 years ago. It started in Europe. The procedure was approved in Europe in 2007, and it basically had a tremendous success. The same year, in 2007, the U.S. Medical trial, which is called the partner trial, was started. It was completed in 2010, and the good results of the partner trial led to the FDA approval of this technology in the United States. The transcatheter valve replacement was FDA approved in 2011 for non-operable patients, and in 2012 for the high-risk patients. So this the transcatheter valve was a complete paradigm shift in the treatment of severe aortic stenosis. Now, those patients who are older, are frail, they have comorbidities, they have a much less invasive way to fix their problem. The chest does not have to be open, the heart does not have to be stopped. This new valve is deployed through one of the vessels in the groin, and the partner trial showed us that the results are very similar with the gold standard, which is the surgical aortic valve replacement. We knew about this new procedure, and we were pretty impressed with the European results. We knew that was a tremendous need here in the US. Approximately 7% of the patients, 7% of the population who's 65 or older have severe aortic stenosis. Again, 30% or so of those patients are basically offered nothing. You know, they just go home and they die in the next 2 years. So it was a very attractive option for us. We made a lot of preparation here at Mon General. Probably a few years, 2-3 years ago, we started to go to meetings. We met people who were part of the partner trials. We talked to Edward Life Science, who's the manufacturer of the Sapien valve, the first FDA-approved valve. So we created what we call a hybrid team that included cardiologists, surgeons, operating room technician and nurses, cath lab technician and nurses, cardiac anesthesiologists. So we're able to work together and create this real heart team. In addition, the hospital was extremely helpful and helped us to build a hybrid operating room. That's a new design. There's a room that's an operating room which has imaging capabilities equal or better with a cath lab. So you can do a transcatheter intervention, or you can do open heart surgery in the same place simultaneously if needed. So basically, when the FDA approval came along, we are already selecting patients for this procedure. We created the MGH Center for Heart Valve Disease evaluation, which is basically a valve clinic where the patient is seen during the same visit independently by a heart surgeon and a cardiologist. The echocardiography is done, so complete cardiac evaluation is done, and the decision is made in one step. Eventually, we performed the first transcatheter aortic valve replacement here at Mon General. We are the first in that region. On November 1st, 2013, we operated on 2 patients, both elderly and with many comorbidities. Both of them did extremely well, and they were discharged home in a few days. This was followed in December 2003 by the 3rd case, which was equally successful. And now we have several patients waiting for this procedure. There is is a new valve coming out which has a larger size, which probably is going to be FDA approved in the next month or so, and we already have 4 or 5 patients lined up for that procedure.